Hey, everybody. Welcome to the first episode and the holiday episode of The Hot Seat. I'm Dr. McKaylee. I'm a peripheral nerve surgeon and a hand surgeon, and I'm here with my good friend, Dr. Basil Nwaoz, one of the finest plastic surgeons and cosmetic surgeons in New York, New Jersey, and Miami. So the way it's going to go today, we're going to discuss plastic surgery while eating some really hot chicken nuggets. These are all increasingly spicy hot sauces. We're going to start in the top left and we're going to work our way to the bottom. We're going to have 10 questions, 10 wings. The question difficulty has nothing to do with the wings, but I'll start it off simply. Do you have a favorite operation?
I get asked that question all the time. And to be honest, one of the reasons I love plastic surgery is because I get to do a ton of stuff. Kind of like coming in and having that variety of working on the face one day, working on the body the next day, doing something that requires a scalpel one day, doing something that requires a cannula the other day. I guess the short version of a long answer is I really like working on whatever the patient wants to have done.
Okay, cool. Why don't we?
Do we cheers?
Yeah, sure, dude. We're coming up with the technique as we go.
So that was the first official question.
That was the first question.
First bites in the books.
First bites in the books. That's a smoky bourbon hot sauce. 607 Scoville units. That's doable.
Yeah. Not so bad. Tasty.
It's not too bad. A little bit of, just a little bit of flavor. I'm not sure that I taste the bourbon just yet, but we'll keep on going.
All right. Are you burning yet?
No, I'm chilling. I think I'm going to beat you in this.
I love challenges, by the way. So once I hear that I'm going to get beat, that turns my grind up.
I'm not sure how we're going to determine what the win is, but I think we'll know if someone loses.
When I was in college,
right,
we used to do this thing, and a bunch of us guys, we'd get together, we were watching sports or whatever, and we would just order a ton of hot wings.
Yeah,
right. Whoever drank water first paid for everybody.
Okay, whoever drank water first. Okay, we can live by those rules. Recently, Dr. B and I, we did a joint case together where someone had a messed up belly. She had liposuction that was done by someone else. She developed chronic pain. She ended up with abdominal cutaneous nerve entrapment syndrome, something totally bonkers.
Yeah, not only that, but this is something that's extremely rare.
Yeah, so she came to me, and I was going to have to do a really ugly incision. So I brought Dr. B along so we could at least try to make it look normal and I wouldn't have to kind of fillet her at the level of the belly button. So she's pretty happy, but it sounds like maybe this procedure was done a little bit differently than you might have done it. How often do you do liposuction? And maybe you could tell us a little bit about what goes into liposuction, like what makes it a good liposuction, bad liposuction.
Yeah.
What thought process is there?
So liposuction is a big part of my business. I do liposuction probably on a weekly basis, almost on a daily basis sometimes. What goes into liposuction? It depends. It depends what the patient's trying to achieve. It depends on what body part we're working on. Are we doing any adjunctive procedures in addition to that liposuction case? Are we collecting the fat to have it transferred somewhere else? So there's a bunch of factors that go into doing it. I think the most important thing is when I have that consultation with the patient, determining what they want, what their goals are, and making sure that those goals are realistic. One of the biggest challenges with liposuction, there's actually two in my opinion. The first challenge is how much fat that person has. Most states have a limitation on how much fat you can liposuction.
I had no idea.
Yeah. So I'm gonna school you guys on that. So in New York, we go by 5 liters. What that means is that when you do a liposuction case, you don't really want to go above that 5-liter threshold. If you do, it's recommended that maybe that patient stays overnight in the hospital for observation, mostly because you're using a ton of tumescent. Tumescent is the fluid that we inject into the body before we actually perform the liposuction. That fluid consists of lidocaine, which helps with pain control. That causes numbing. Epinephrine, which helps with bleeding. It causes the blood vessels kind of shrink down so that you don't bleed a lot. And sometimes we put something called TXA into it, which kind of helps also with reducing the risk of bleeding. We mix all of this in a bag of either saline or what we call lactated ringers, which is basically IV fluid. And then we inject that underneath the skin. We give it a little bit of time to act, and then we perform the liposuction. And liposuction is think of it like basically taking a vacuum, putting it under the skin, and you're sucking out fat into a container.
Okay.
Yeah. Oh, okay. Salud. All right. So which one is this one?
Well, this one's 1,200 Scoville units. There's a little more spice on it.
Mm-hmm. Yeah, this one's got a little more kick.
This is called Voodoo. I guess it's just fake.
I won't lie. I kind of like the taste of the other one before it. I think it had a little, like, a little sweeter tinge. I mean, don't get me wrong. This one's not bad, but I felt like this Vino one was kind of like more tasty, in my opinion.
Yeah, I don't know.
By the way, I can tolerate a lot of spice. Hopefully, this doesn't end up biting me in the butt later.
Yeah, we're gonna find out.
I guess we'll find.
Don't have the right kind of surgeon here for that.
Yeah.
So
we might have to call a consult.
Yeah. So is there a difference when you do liposuction between like men and women? Like, is there any technique differences? Like what do you think was the issue with that lady that caused her to have all of those pain complaints from the initial liposuction? Do you have any thoughts on where things might have went wrong?
Well, listen, I would probably say I've only seen a few cases where someone's had intractable pain after liposuction like that. It's extremely rare. I can't really speak about what happened during her first liposuction or during the liposuction case, only because I wasn't there. I don't know what instrument was used. I don't know what kind of fluid. Everybody kind of has their own recipe sometimes. That's how much, the numbing stuff they give, how much of the epinephrine they give, etc. So I don't really know what technique that physician used. So it's hard to comment on that without actually being there to see it yourself.
Okay.
But with that said, intractable pain after liposuction, especially when it presents itself like a neuroma, it's really, really hard. Sometimes you can get into the wrong plane. I will say this, liposuction is a blind procedure. And what I mean by that is we make these little tiny cuts in skin, and then we place this cannula underneath the skin in a space called the subcutaneous space. I like to think of it like a hamburger. So the skin on top is like the bread of the burger. The subcutaneous space is basically like the beef patty. You insert that cannula into where the beef patty is, and you can't see underneath the skin. So basically your other hand is kind of like your eyes. So everything is tactile. You're using your fingers to basically guide and be your eyes for what plane you're in and where you are. Nowadays, you can actually use ultrasound to kind of guide you and make sure you're in the right place. I use ultrasound a lot, especially when I'm fat grafting. And sometimes I use it in liposuction. But again, even with that said, you're not directly looking at the field. You're still, looking at it, be it through a ultrasound probe, be it through tactile feedback. There's no direct visualization of what you're doing. So you really have to be kind of cognizant and aware of where you are. And if you happen to get lost or for any reason end up in the wrong plane, things can happen. And maybe that might have been what happened in this case.
Okay. Yeah. So
because where the nerves sit is actually not on the layer of where the subcutaneous fat is.
Yeah.
It's actually below that.
Yeah.
So to end up with that kind of a problem, you might have gone deeper than you needed to go in order to.
I agree with that. That sounds about right based on what we were seeing.
Part two of your question is whether liposuction is different for men and women. That's actually a great question. When you're working on a man and you're working on a woman, you do have to take into consideration the anatomical differences, especially now that we do a lot of high def liposuction where we want to kind of bring out that musculature. When I'm doing women versus when I'm doing men, there's different aspects of that physical anatomy that I want to highlight. In men, I really want to kind of highlight their muscular, anatomy, that muscle tone, keep them still looking masculine. In women, I want to bring out that femininity. I want to really create that, what I call body harmony, where they have a very nice proportions, chest, waist, hips, legs, etc. That's really kind of what I pay attention to, what maintaining those aspects of the body that makes women feminine, makes men masculine, and keeping that at the forefront of the objective of what I'm doing.
Awesome. Let's keep rolling.
Let's go. Okay, so where are we now?
So I think now we're on number 4. I really don't taste much on it. How about you? This is 3,500.
I'm not worried.
Yeah. Maybe
This is going way easier than I thought it was. We're almost halfway through.
This is going way too easy. I think we're going to need to kick it up a notch. I mean, maybe feeling a little bit on the back end, but really nothing. Nothing throwing me for the jar yet.
So far, I'm doing all right.
Yeah, I think so too. Okay, you did general surgery and you did plastic surgery?
I did.
Okay, fantastic. So you must have some great stories, I imagine.
Oh, yeah.
we won't say where any of these took place, right? We're going to try and respect patients. We won't give years, locations, right? We're going to try to stick with HIPAA. Like, what do you tell when you're sitting at the bar? What's your story that you tell people about your surgical training, either from plastic surgery or general surgery?
Every 4th of July, right? We cover hand when I was training in plastics, right? And I went to a program that was fabulous, and we did a lot of, hand surgery, and they trained us very well. And we were trained to be very good, very efficient. And every 4th of July, sure enough, somebody wants to blow up a firecracker while holding it. And so, the unsuspecting intern who starts out fellowship on that weekend or 4th of July holiday is always going to end up with some kind of an exploded hand to some degree. I've seen all kinds of injuries. I've seen all the fingers blasted off. I've seen no remnants of fingers. I've seen partial remnants of fingers. But that's kind of like the one thing I would say that really jumps out to me is,
Okay.
yeah, that sounds like,
That was a nice segue. Yeah.
okay. That one's got a little more kick to it.
Huh.
Yeah, hand stories. You can get hand stories for days. I mean, I think of another story now in the middle of you telling that one.
Yeah, go for it. That's
Just
spice, by the way. No flavor. Zero flavoring. Just 8,000 Scoville units of just spice.
That one has been the strongest one so far.
That one is very strong.
Yeah.
And has zero.
It's starting to sweat a little bit.
Yeah, that had zero deliciousness to it. That was just
Actually,
just spice.
Actually, that's my favorite so far.
Oh, well, that's odd, and you're weird.
I've been told that.
Okay,
Yeah, but weird is special. Weird is unique.
Yeah. So now tell me your story. So where were you guys?
So I had this guy, young guy,
Yeah.
probably in his mid-20s, and apparently the marriage wasn't working out. So he got into some kind of a heated argument at home, and she had actually presented him with divorce papers.
Oh,
and he screams, "I am not going to sign those." And to prove his point, he cuts his arm off.
Oh my!
Right in the mid-forearm. Now you would think, okay, I don't think cutting your arm off can stop, papers from being signed. But anyway, what a crazy story, right? So this guy shows up. Not only did he cut the arm off, but then he took a blowtorch and decided to cauterize the stump.
Oh,
because he didn't want any ability of it to be reattached.
okay.
He comes into the ER, and obviously, he's on the stretcher, his arm's in the bag, and we proceed to take him to the operating room to reattach his arm. Now, this is a very interesting story because it brings into the concept of he's saying no, he doesn't want this done.
Yeah.
And that he is of sound mind and sound body. He has the right to decide how he wants to be treated. He has complete autonomy. But now you got to question, well, what is he, psychologically appropriate to make that decision at that time?
It's interesting.
That's an area, interesting question of ethics here, right?
Yeah.
And we're faced with these kind of dilemmas all the time. So being that, we listened to the story, and based on the basis of that story, we didn't think that he was able to make a reasonable decision.
So you put it back on?
We reattached it. Oh. Yeah. And afterwards, he did well. He did have to spend some time in the psychiatry department.
I'd hope so.
But he was appreciative. The arm was functional. And, went on and lived his life. Now, I don't know how the story ended up with him and his fiance, but...
well, I guess they didn't get divorced, though, because he couldn't sign the papers, so they must be happily married, I guess.
They married.
That's the only conclusion that one could draw.
Obviously.
I mean, that's... Yeah. I mean, I couldn't
but
think of another way.
That's a really interesting story. I would say that's probably one of the most interesting.
Yeah, that sounds pretty impressive. Okay. So... Dr. B.
I can't drink yet.
No, yeah.
I didn't sip.
He only thought about it.
I thought about it.
He only thought about it. So do you do breast surgery as well?
I do.
Can you just give me a quick run over what are the different kinds of breast surgeries that people might go from?
Yeah. I think the quick and dirty of it, I like to look at it on an age spectrum. So younger women tend to have breast augmentations. Augmentation just means you're putting in a breast implant. Breast lifts, they're really super, super heavy pendulous breasts that are just hanging down and making it uncomfortable to wear clothing or exercise. And that also falls into the same category as breast reduction. Okay. So I think in the younger women, I tend to have patients who present for either a reduction of some sort. They suffer from what is called macromastia, which is a super large breast, or they're coming in with micromastia, which is the opposite of that, which is small breasts. And they either want to be bigger versus they want to be small. For different reasons, they have those surgeries. Usually women who want to be smaller, they have really large pendulous breasts that interferes with their daily activities. They're unable to run, unable to exercise. They suffer from neck and back pain. And, when they buy clothing, it just doesn't sit right. And so it really kind of affects them, not only just in terms of activities, but also in terms of like body image and all of that. So I would say in the younger category, those are the two surgeries I tend to do most of. In older women that have had children, they tend to develop ptosis, which is basically saggy breasts. And that's after like having a child and, breastfeeding. When you're pregnant, your breasts engorge with milk.
I've never been pregnant personally.
Yeah, well, I mean,
the mother of my children has, though. Yeah.
Well, listen, there's no judgment here. There's a judgment-free zone. A lot of women come after having children, having breastfed, and they want to have like what I call a mommy reversal. That's my term, where we actually relift the breasts, reshape the breasts to give them a more younger, perkier appearance. That's something I recommend to women who have finished having children, because you don't want to do that and then have more children and then just kind of redevelop the same thing. It kind of be a futile effort. The other side of the spectrum is obviously where we do breast reconstruction. And that comes more in the flavor of women who've had like breast cancer or diagnosed with some kind of breast disease or breast illness that requires either a partial or total mastectomy of some sort. They need breast reconstruction afterwards.
Cool.
Okay. That one was, I'm guessing, a 6.
Yeah.
But it wasn't as spicy as the 5.
That's what I'm saying. I mean, on paper...
You didn't mix them up?
No. So on paper, it's almost 9,000 Scoville compared to almost 800. I mean, almost 8,000. But yeah, that doesn't, not hitting the same way.
No.
And I made sure to bite...
Now it's almost like a delayed hit. Like you feel it like kind of creeping right now.
Yeah, maybe a little bit.
A little bit?
Yeah.
But the other one I got to say is like...
That one had a little bit of a punch. Tell me, do you ever talk people out of getting procedures done?
Yeah, I mean, there's certainly certain procedures out there that are trendier or more like fads. Those things come and go. I tend to try and talk my patients away from the fad type of procedures, because over time, they're not going to like it. They're going to fall out of fashion. The things that actually last forever are very simple, natural appearing procedures. A nice, naturally, not too over the top, breast enhancement, liposuction with some really like elegant, fat transfer. My patients tend to like more of that natural appearance. So that's what I try and give to them. And our goals at the end of the day is really to kind of provide that body harmony where it's not falling into the category of a fad or a trend, but is giving you a result that will withstand the test of time. And that's really what we kind of aim for.
Okay. Yeah, fair enough. Do you do any mommy makeovers?
I love mommy makeovers.
Here, I'll bite.
All right.
Yeah, tell us about mommy makeovers.
And that was a 7?
Yeah.
Donuts? Donuts a 5.
Yeah, still not.
No, there's a sauce. I'm biting right into the sauce.
I mean,
number 5 so far. I gotta say, I had the biggest kick. That was this one. Right?
I think we're in the ghost pepper now. That was this one. It was the fiery cayenne. Now we're doing the ghost pepper. But now I'm starting to feel a little bit on my hard palate.
Yeah?
Yeah. Interesting. Because the number 5 I felt on my tongue. This one I feel on my palate. That's a interesting sensation. I don't think like would be the word that I'd use to describe it. A little bit of discomfort. Getting a little emotional just remembering the good old days when we met,
No, this number 5 so far for me has been the hottest.
Okay.
The other ones are okay, but number 5, not only was it hot, but it actually tasted kind of delicious. So I like number 5.
Okay, fine. Number 5.
So let's talk about mommy makeovers.
Yeah, tell me about mommy makeovers.
A lot of people coin different terms for them. Some people like to give that procedure their own like name or whatever is cool or in vogue. Basically, it incorporates a group of procedures, usually more than one, where you're doing a combination of either something on the breast and something on the body. And it could be, I guess traditionally, when you think of mommy makeover, you think of something like a breast lift and a tummy tuck. And you're basically just kind of reversing the changes that a woman goes through after she's had children. Some people, instead of having a tummy tuck, may have lipo and something with the breast. Some people may have lipo and a tummy tuck. I just always tend to think of it as a combination of procedures that are basically aimed to rejuvenate the feminine physique, especially after having children. So it can be a combination of a couple of different things. Traditionally, it was always thought to be like breast, tummy tuck, but these days it could be a lipo with some fat grafting to the breast or the buttocks. It could be a breast lift. It could be a breast aug with the tummy tuck or liposuction. But usually it's a combination of one or two of those things.
Okay. Yeah, I guess I didn't realize that. I thought it had like a set definition.
All right. Wow, we're moving right along. Now we're up to, is it number 7 or number 8 here?
Number 8.
Okay. This one has a little more kick, I think.
20,000 Scoville units. We kind of just,
Yeah. So with this one,
yep.
With the first bite, I felt it.
Yep.
I could actually feel it kind of like trickle its way up my nostril.
Yeah, that's
I like it.
It's a very.
I want beat number 5. Number 8 so far is my favorite.
That's a very emotional.
Yeah.
Hot sauce right there.
Remember when you were a kid?
Yeah. Remember that first time I skinned my knee? Yep. No, that was rough.
Takes you back.
Yeah. My dad said, "Get up," and I did.
Yeah. Listen, drink your water bottle. Bye. Maybe needing it some.
Oh yeah. If I'm thirsty, I'll just take a swig.
Somebody call 911.
No. Okay.
That one I would say has the most kick so far.
That's
It's a little delicious.
Well, I mean, I don't know that that's the word that I would use. Delicious is not my top choice.
I love spicy food, by the way, so this is like better.
But it's definitely hot sauce.
Yeah.
It's
Get emotional.
Yeah, I
remember how we met.
Yeah, I just remember how we met. Just like the good old days.
Yeah. Listen, man, I remember pounding that pavement in the hospital. It was like the gift and the curse, man. I mean, literally, like residency, especially surgical, it's like army training. It's like military training. Oh man, you're punctual, you're on time, you do your job, you stay focused, and you get up the next day and do the same thing.
And then again and again. So we're talking about things that are in vogue, right? Fads. What cosmetic trend today do you think is like going to be out in 5 years?
I think fox eyes for sure, where they really kind of have the split elevated eyebrows, fading that stretched look. That's gonna fade. I think the super large BBL is already on its way out. I think women now are looking for long, lean, more body harmonizing outcomes. They don't want anything to be too voluptuous. I think people are looking for more natural results. People want to look more sport. Up to 9?
No.
Not bad. How you feel?
It's not as bad as number 8.
8 kicked more.
No.
I can't wait for 10. We're at the top of the food chain at that point.
Yeah. I mean, I do have to blow my nose, though. Pardon me, we're just going to cut. I'm not drinking, but I'm going to grab a tissue.
You're falling to pieces, man.
Oh, my God.
You are falling to pieces. Yeah. 8 was the strongest one.
Oh, man. I could blow my nose.
Look at him. He's starting to melt.
Okay. It's cold. It's cold season, right? And my kids have the flu. It's nothing to do with spice.
You sound like one of those guys watch take a rom-com. It's like,
And I saw Love Actually yesterday. It's all very
here.
Yeah. There's a cat. Saw Love Actually. It's tough. Anyway, sorry. What were we talking about? Have you done any remodeling? Do you know anything about this?
I've done it. It's not a common request, but every now and then I get patients who ask about it. Yeah. I honestly don't think it makes a super huge difference. Obviously, it has to be the right candidate, and the right candidate looks superb. And again, the rib remodeling, it's not a rib resection. We're not actually removing a rib. We're just actually kind of bending the cartilaginous ones to trim down the waist size. And then, we put you in compression, and that helps to kind of reshape your body. When I think of liposuction, I think of liposuction like, imagine you're making like cake batter, right?
Yeah.
So you whip up the cake batter, and then you put the batter in a pan, and you allow it to bake, right? So when I'm in the operating room, that's basically what I'm doing with the liposuction. I'm kind of making that batter, and then I put you in the faja for a couple of months. And then while you're in that faja, you're healing, and your body is taking shape. And there's a protocol that we use in my practice, and we reduce the size of the faja at a certain interval.
Sorry, what's a faja?
A faja is a compression garment.
Like a corset, right?
Kind of. I mean, it's a compression garment. It usually covers, from your neck down to your mid thigh. Some are full body, and they look kind of like a full jumpsuit or a cat suit. And basically, it's made out of a material that stretches and helps to compress and keep the skin pretty much tighten it into the mold that we want it to be as you heal.
Okay.
Yeah. I think most people's protocols is as you progress down that healing interval, they decrease the size of the files over time to kind of get you, where we want you to be in terms of the final outcome.
Okay. Yeah. Cool. So I think we covered a lot. We're getting to this last bite over here. So we might as well end with an easy question.
Oh, one thing I gotta say, and I just remember this, is that I'm starting to see a lot more BBL reversals from patients who've had really, really large fat grafting done. They're kind of, over time, gravity is going to take effect, and maybe what might have looked great when you were, in your 20s or even your early 30s, once you get into your 40s, it can start to sag. And not only that, but as the trends change, as they all do, people want to be, less curvy or less bottom heavy. I'm getting a lot of patients coming in now to have their BBLs reduced in exchange for more normal, natural appearance.
Yeah, I'm not surprised to hear that. I feel like that totally tracks. And last question, what's your favorite part about being a plastic surgeon?
Two things I love. I love the people I meet. My patients are fabulous. They come from all different walks of life, and it's really kind of like a gift and a privilege to be able to meet and work with so many different people. And then the other part of that is I love the ability, like I said earlier, to have a variety of different surgeries and procedures under my belt.
Awesome.
All right. Oh my God. No, I'm kidding. I was not that.
This one's actually kind of nice.
Yeah, this one's kind of sweet. Like, like a
peach ghost pepper.
Yeah, peach. I was going to say peach, some kind of fruity aspect to it.
25,000 Scoville.
So in your pan, which one's the hottest? Or the worst? The worst for you? This one's kicking in.
I mean, don't sleep on the only problem, by the way, is that, I kind of modeled this after a podcast that I absolutely love.
Yeah.
Okay. So it is called Hot Ones. You guys are awesome. So don't want them to think that I'm stealing their content. And number 8 on their show, everyone says is the worst. And by chance, total coincidence, 8 happened to be the worst today. I promise it was a coincidence. So I'd say 5 was spicy. 8 I just did not like at all. And 10 is obviously spicy, but nowhere near as bad as number 8.
Yeah. 8 was good.
Well, dude, thank you for coming into the hot seat. I had fun. I hope you did too.
I did too.
Awesome. Thanks.